can you tell us the first patient to whom you said, hold on, before I cut you open, I want you to follow this kind of eating, or let's talk, or maybe it was someone who came to you after you performed on them, and you said to them, hold on, if you don't want to get another occurrence, then let's look at your lifestyle.
Yeah, I'll tell you, I believe that things were aligned. Everyone has a different faith. So whether or not you believe in the stars or you believe in a higher power or believe in God that directed, I had a colleague who actually hired me on, and he sent a patient to me for a second opinion, mainly just for me to look over his case and to talk about performing an intervention on his arteries. And as I sat down and spoke with he and his wife, I kind of I didn't even have an elevator pitch. Right? I didn't have my little routine down of my quips or the things that I would say. I didn't have references. I just spoke from the heart. And I just kind of told them, I said, listen, you will continue to suffer unless you're basically willing to kind of change. Mm-hmm. And all I did was write down one or two books, a Joel Fuhrman book and the S.E.L.F.I.S.H book for them at that moment. But what's so interesting is I had a series of patients, all three, back to back, not the same day, within a month period of time. All three came back touting how much benefit they achieved. My colleague, who was a skeptic, said, Columbus, I don't know what you told my patients, but they're doing better. That was my first entry into this area. Was just really with just saying, you know what? And that's what tells me about for other healthcare providers and for people. You don't have to wait for perfection. You don't have to wait for you to have all the knowledge available to you. You don't have to wait for you to have everything aligned just perfectly in your life to start. Just start. Mm-hmm. Just start.
And you don't also have to be, so I've heard Esselstyn talk and how he doesn't even want anyone to have a piece of cake on their birthday because he believes that, that if you're going to eat plant-based, you need to eat whole food plant-based, you need to go all out to save your life. He sees a lot of, and you probably do too, patients who are at the end of their lives or struggling with long-term disease. But how do you approach that moderation versus, I don't know, that journey? Because moderation's great. All in is good for some people, but it doesn't work for others.
Yeah, no, you're absolutely right. And I'll tell you my evolution of how I meet people where they're at. And so everyone's different. There's not a one size that fits all. But what I tell individuals, and I think the Adventist Health Study too really pointed this out, that every movement that you make towards healthful eating, as you move from eating any and everything over towards, this or vegan or vegetarian and so forth, you begin to make this journey of improvement in your health outcomes. And that's power that's there. So there is power in small steps. But I also tell, here's the analogy I use, right? Most people work starting in their 20s, and they're putting money aside to their retirement. Now, if I work from 25 and I say I retire at 70, if I miss 1 or 2 months when I'm 25 to 30 or longer than that, it's not a big deal, right? If I wait to invest in my retirement until I'm 60 and I plan on retiring when I'm 70, I need to go all out. Or guess what? The likelihood I won't be able to live the life I want to live is extremely high. So when I meet patients who are at a particular point in that spectrum of care, that they have heart disease, diabetes, they've had heart attack after heart attack and stroke. Yeah, what do you want? If you want to live a life where you maybe don't have to see me as often, where you have less medications, you have to go all out. If you want quality of life for your family and be there for your grandkids and your kids and for those that you love and to fulfill that purpose in life, then you have to go all out. If you're younger, I still want you to go all out. But if you were to slip every once in a while and you have this, that, or the other, or you decide that I want to have the standard American diet, vegan style food, right? That still isn't necessarily helpful for you. It probably is not going to be to your complete detriment, but you have to know yourself. I'm a sugarholic. One piece doesn't do me well. I know what I'm capable of. I'm that guy who would go to the grocery store and buy a box of whatever the frozen desserts are, open it up and have one. But because I knew my wife was going to look at me and say, I can't believe you opened that box, I'd eat the whole box. Right? That was me. That was me. So I know myself. I'm not just a handful of peanuts and put it aside. I'm going to eat the whole can. You have to know yourself and be realistic and honest with yourself, right? And that's where it is. That's what becomes important.
And you don't only advocate for a food change, there's a bigger holistic look that you take. Can you share with us the different aspects of lifestyle that you talk to your patients about that you feel
Yeah.
really make a difference to the heart?
It's, I'll tell you, everything in life that we do impacts our heart. And that's the beauty of the simple things. We always think that we want the sexy and the novel and the high tech things. It doesn't have to be all of that, right? So you can be completely whole food, plant based and be angry, don't get any sleep, you don't move. Guess what? You're not going to be healthy. We see stress is at an all time high in this country. We see that all of the stripe that's there. And so there's an acronym that we'll talk about later that I evolve into. I'm looking to write a book on this, and hopefully that'll come out in the fourth quarter or so of 2022. But it's entitled Selfish. Selfish. I tell people you need to be selfish. And so it's different than self-care. Self-care is focused on yourself. By being selfish, although it sounds like you're focusing on yourself, it allows you to live a life of purpose. So selfish starts by being, we say, spiritual. And it's not in a religious fashion. That could be deep breathing. That could be spending time in nature. That could be prayer. That can be meditation, because studies have shown that enhances your prefrontal cortex. Studies have shown that by doing this, that you're actually able to dilate the vessels and relax that special lining called the endothelium. Studies have shown it lowers the blood pressure. Studies have shown it decreases the perception of stress that's been tied to disease burden. There's power in terms of getting spiritual, which is the first S in selfish. The E stands for exercise. Now, exercise is really, that's a modern term, right? Because back in years ago, exercise, as we call it, could be simply going out and plowing the field, mowing the lawn, picking the vegetables. But many of us, we have desk jobs, like myself. All right, I'm culprit number one. And so that means I have to find methods to move more. So I start off by saying, get neat with it. Non-exercise activity thermogenesis, stand more than you sit, park further away, take the stairs. Then we progress and say, okay, let's start to count your steps. And let's try and build on that and increase that. Tells me that you're active, not just for a half hour of working out, but throughout the entirety of the day becomes important, because studies have shown that, guess what? That's another keystone habit. As you begin to move more, now you're encouraged that I want to eat better. Guess what? I feel my stress has gone down, especially when we exercise inside of green environments, outdoors in the parks and in nature, if we're able to get access to it. It has tremendous powers, healing powers for our mental health, which is important and helps us sleep better. So then we look at love. What do we hear on the news all the time? Just hate, 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 hate. But love. So you talk about love, it's like, okay, doc, love, that's your cardiologist, the heart doc, I get it. But yeah, well, let's look a little bit closer. Oxytocin is the anti-stress hormone, the tend and befriend instead of the fight or flight. It's a hormone that has reparative functions on the heart muscle that dilates the vessels and lowers the blood pressure. But not only that, love is an action word. Right? So anyone who's been in a relationship, whether it's a friendship with a significant other, you understand it takes work to love someone. That means love requires you to forgive. Love requires you to express gratitude. And when you love, right, when you express gratitude and forgiveness, guess what that's been shown to do? That's been shown to help decrease the burden of lack of blood flow to the heart muscle. It's been shown to dilate the vessels. It's been shown to lower the blood pressure. That gratitude has been shown to have phenomenal benefits on the body and on the heart specifically, as we're talking about the heart, right? So that's where the L in love for selfish comes in. The food, it's no magic, right? Real food, whole food, plant-based food, foods that decay, foods that your bacteria want, right? We see these old Golden Arch burgers and fries that people will find. I read an article from several months ago. Someone found one, I believe it was in Chicago, that had been there for about 70 years and looked the same, right? We don't want that, right? We want real food to enrich the body. The I stands for intimacy. Right. And so intimacy isn't, once again, sexual. It can be your pet. It can be your animal. And that care, I always joke inside lectures and talk about, my mom says that her best friend is her dog Precious. Not me, who she lives with, not her daughters, not her eldest son. but her dog Precious, who knows how she's feeling in every moment. Right? There's power that studies have shown. We're seeing that loneliness, that we're all coming out this pandemic, that loneliness is divisive. Loneliness kills you. Loneliness has destruction to you. We're made to be intimate, to have relationships. And so that intimacy is extremely important. What's the last S stand for? Sleep. The thing that we always give up to accomplish what we think we have to in life. Right? So many of us are not sleeping the amount of time either because we have medical issues of sleep apnea. We're taking medications that keep us up at night, or maybe we're stressed. But so we don't spend time in that restorative, reparative period of time. A third of our life that's hidden is extremely important and affects everything that we do. And so I get into to sleep is something that I speak to with every patient. And last but not least, I ask every patient, what's the last thing you laughed about? What's the H stand for humor? What's the last thing that you laughed about? Whether it's a dirty joke, if it's a television show, and there's times I'm on call and it's a weekend lonely, I'll just put on whatever my favorite comedy is and it's playing while I'm reading studies and I'm just laughing out loud, right? The original LOL, I'm laughing out loud and people are probably walking by the door wondering what is going on in that room. But that's a way that it has restorative values to the heart, to your vessels. And so there's power that's there when we get selfish. And when we do that, guess what? We're receptive to life. We're receptive to other individuals, and we're ready to live a life of purpose. And that's what the goal is to be able to live a life of purpose.